Guys, it's Dr. Ruth Roberts, the creator of the original Crockpet diet, and you're getting an exciting view of the basement to be. So as many of you know, we're in process of selling the house and going through stuff and all of that. So sorry for the view today, but hopefully it'll all come to fruition. And you'll have to pardon Mona. I think she's in a whiny mood today, so you may hear her complaining bitterly about her accommodations because it just doesn't suit her princess needs. So today I had an email, or a message rather, from Mary, and she has a Dobie that has an autoimmune disease. And the dog has been diagnosed with something called Pemphigus, and that is not fun. So that's kind of a miserable type thing. And the dog is on a tremendous dose of prednisone. If you've had a dog that's been on prednisone, you know how much fun that can be. And unfortunately, her pup has been on it for months. And so what she wasn't clear about in the email or the message was if things are getting better, how many lesions there were, that kind of stuff. And so I want to address that a little bit. And Jennifer and everybody that's sharing the video, thank you so much for doing that. I really appreciate you doing that and helping me get the word out about stuff. So let's talk about autoimmune disease for a moment. In dogs, most commonly we'll see them show up in the skin, although they can be anywhere. So for instance, we have autoimmune hemolytic anemia, autoimmune thrombocytopenia. So literally what's common in all of these diseases is that for some reason the body has created antibodies to its own tissues. So for hemolytic anemia, that's antibodies to red blood cells. For thrombocytopenia, that's antibodies to platelets. So both of those diseases, as you might guess, can get into a crisis situation really pretty rapidly, which is horrifying, and they are difficult diseases to treat. As I said, many of the other ones show up in the skin. So pemphigus, bullous pemphigus, there's several of them that are just around the nose and the mouth. There are others that show up in the skin, sort of all over the body. Dogs get lupus, systemic lupus or erythematosus. So there's just all sorts of stuff that can happen. There is an autoimmune disease where the dog creates antibodies against its own toenail bed. Horrible. Their poor little toenails just pop off. And so, you can imagine that's painful and miserable. And so that's not fun. So the conventional approach is to suppress the immune system so it stops attacking the tissue, the body's own tissues. And that works to some degree, but not completely. And then the other issue is that the medications that we have to use to do that, prednisone, Imuran, cyclosporine, all that stuff, those have side effects, some more intense than others. So Mary mentioned that her Great Dane is on 100 milligrams of prednisone, which is a whopping dose, but that's actually the autoimmune dose. Generally, once things come under control, then we can taper it down and that sort of stuff. So I'm going to want you to kind of think about this in terms of why do these dogs and why do these cats less frequently get into autoimmune disease? And sometimes there's an instigating factor. So for instance, the veterinarian that gave your dog all 7 vaccines at one time, that's been associated with sentinel in dogs. And then many times there's no specific thing that appears to have kicked it off, but all of a sudden whatever disease gains steam and it's just a nightmare. From a Chinese medical standpoint, it's damp and damp heat, in a variety of patterns, but there's always heat and damp involved. And in the functional medicine standpoint, there's a couple of things that's happening. One is that inflammation, your body level of inflammation is just off the charts. And so the cells begin to behave abnormally. And so this is the same kind of underlying mechanism for cancer as well. The immune system is supposed to be able to surveil the cells within the body and say, ooh, that cell over there is not right, so I'm going to take it out. And what happens with cancer is that the immune system is unable to differentiate the abnormal cell from the normal cell because there's so much garbage in the system. Same thing with autoimmune disease, proposed mechanism also for many of the thought to be just due to aging types of heart disease, valvular disease, kidney disease, liver disease, blah, 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 blah. You get the idea. So again, inflammation, any disease that ends in itis means inflammation. So dermatitis, gastritis, gastroenteritis, blah, blah, blah. You get the idea. So as far as what can we do to help Mary's dog out? Because it is just icky to have that much steroids on board all the time. Plus, as I said, those medications have side effects of their own. And what I generally will do when I've seen patients with these issues is you need, in certain situations, particularly with autoimmune hemolytic anemia, thrombocytopenia, you need Western medications to keep things under control until you can get your pet's health sort of turned around. And the reason is that the time it takes for food therapy, for supplements, that sort of stuff, is going to be too long for that crisis situation. And there is too much pain and suffering for this animal to not use these medications to help it feel better. So the goal is going to be A, get the crisis solved. So, and Mary, it sounds like you've got that under control. And then B, start changing the diet. So if we're going to change the diet so that we've got essentially an anti-inflammatory diet, one of the things we want to do is take out simple carbohydrates or minimize them terrifically. So we may not need a keto diet like we might talk about with a dog or a cat with cancer, but we do need reduced simple carbohydrates. So just to review that, there's simple and complex. So simple are things that you can break down into sugar really pretty quickly. So that's things like white potatoes, sweet potatoes, rice, any of the grains. Complex carbohydrates have fiber in them. So those are going to be things like beans, broccoli, spinach, vegetables essentially. So anything with high fiber that's going to slow down the ability of the digestive system to break those simple sugars out. So more towards complex carbohydrates, much less simple carbohydrates. And so that means looking at, everything, treats, food, all of that. And because, again, the gut is implicated in detoxification and 70% of the immune system, we're going to want to make sure that the gut is working really, really well. And so even though this dog may not have any GI symptoms like vomiting, diarrhea, gurgly belly, that kind of stuff, that's where I would actually talk with her about doing my gut health program. And essentially what that is a rotation and elimination diet. So you want to figure out everything that animal has been eating for the last 6 months consistently, and then develop 3 sets of meals essentially that rotate every 24 hours. So the idea is to calm down the immune response to what that animal is eating, because again, if we have a leaky gut going on, that animal is absorbing partially digested food, which is being presented to her immune system, and so the development of these antibodies get fueled up because the immune system is so cranked up because it sees all these invaders and it wants to get rid of everything, and so sometimes it miscues on its own tissues. So clean up the gut, do that rotation and elimination diet, get it healed, get it sealed back off, and using things like fish oil, high doses of probiotics, There's several other things we might use, like vitamin C. There are several Chinese herbal formulas I've used that help support the immune system. This is where I would actually consider standard processes of immune support, and just kind of go from there. With the goal in mind is that we're not going to fix it in 2 weeks, and it may not even be a month. So the goal in mind is to give time to get everything under control, get out of the crisis, get things stabilized. And then that's when I would start titrating down off of the conventional medications. And you want to do this extremely slowly and give it at least 2-week interval in between each decrease of dose before you try to do something else. Because it can take that long for things to declare that, oh no, we're not really quiet down here, so you better crank it back up a little bit. So, for instance, for Mary's dog, that's a dog where I might add in a medication called Imuran, as well as the prednisone. And Imuran, or azathioprine, is an immune suppressive drug, but the upside is that if it is well tolerated and the side effect of suppressing the white blood cell count is not present, and then the one other potential issue with it is it can cause some pancreatitis, although that's very infrequent. If there's no issue with that medication, the upside is that it allows us to go to twice-a-week dosing, sometimes 3 times a week dosing with that medicine, and then start to decrease that level of prednisone, which takes the pressure off of all of the organ systems. Plus, the side effects of prednisone at that dose are just awful. They're drinking a ton of water, they're peeing a ton, they're ravenous, they're agitated. The few times I've ever had to take a steroid, I was nuts. It just was awful. I almost punched out a parasitology professor. So it just horrible, road rage. And I'm not that kind of person. So the medication can make our pets feel that as well. So that it stinks. Sometimes it's what you got, but in many cases, if the owner is willing to stay consistent with high quality food, using something like the original Crockpet diet, because unfortunately, even the high quality dry foods are still something like 67% simple carbohydrate. So it's very difficult to get immune disease under control if that's where the animal is, what that animal is staying on and eating. So that's kind of the short and long of it. Just the way I try to break it down is, what are the simple mechanisms that we can get an understanding of to help improve this pet's quality of life? And that's it. So our main one there is to reduce inflammation and improve immune system function and detoxification, because that's the other thing that's going to happen. This poor pup has got a ton of steroids on board, which is going to make the liver very unhappy and make it have a more difficult time in detoxifying. And B, the immune system is responding to tissue because there's too much garbage through the whole body. And so the ability to detoxify, if we can improve that, then we can improve getting the junk out of the system and decrease that overall level of alert for the immune system as it operates in the body. So that's my down and dirty. As I said, the gut health program is on the website at theoriginalcrockpetdiet.com. Go check it out. It has been extremely helpful for so many pets. And, and I can't, I've named it gut health, but I don't think that really gets the picture across. So if you've got a suggestion for a name that would make you understand that this is really to help combat not only chronic gastrointestinal disease, but any type of chronic disease, let me know what that is, because sometimes what I think makes sense doesn't make sense to the layperson. That's the problem with all the $10 words flying around in there. It's like I end up speaking a different language, and that gets confusing for y'all too. So that's what I've got for you today. Have you guys got any questions I can answer for you? And while you're thinking about that, the other thing I'll let you know too, again, Holistic total body support, part of the reason I designed this supplement is because it includes glandular materials, and it is a much less expensive option for something like standard process whole body support. But I really believe that the glandular materials help the immune system function better, and we can optimize other organ function much better as well. So we do have a new pricing structure for it. So you buy one bottle, it's whatever it is, sort of the big dog bottle, for instance, it's $33.60. If you buy 2 bottles, you get 1 free. If you buy 12 bottles, you're going to pay for the price of 7 and essentially get 5 free, and always free shipping. So that's what I have for today. Sally, good to see you. If you guys don't have any questions, I'm going to sign off and get back to sorting out all this stuff. Yard sale soon. Remember, your pet's best health starts in the bowl, and Jennifer actually popped one in just before, and she's thinking of, before I signed off, so she's thinking of starting her 3 cats on the Crockpet diet, but they are so picky and they refuse the vitamins. So here's the deal with cats, and I think in the Crockpet ebook I talk about this. Literally, one of my cats, Romy, who's now 15, it took me 6 months to get her from dry food to canned food. So that's the first step. If they're on dry food, switch them to canned food first. And the way to do any change with kitties is to put just a teensy amount off to the side. So literally, you may be starting with a half a teaspoon to a teaspoon, and you're just going to put it off to the side of the kibble. And the goal is for them to get a little bit more familiar with it. And it's good to hear they love canned food. So if they're down with that, Jennifer, you've got half the battle won. So for Romy, the next step was getting her from canned food to cooked food, and that took me another 3 months. And there are days where she's like, ew, this is disgusting. This is the most awful stuff in the world. So again, start slow, half a teaspoon to a teaspoon per meal. Once it's been in their bowl and sort of in their realm of understanding for a week or so, then mix it in with the canned food a little bit. And same thing with the vitamins. Literally start with a pinch and let them kind of sniff around that and get used to it, and they'll eventually try it. I will say there are some cats that are like, no way, Jose. And, despite everybody's best effort and intentions, they just would not buy into the idea of cooked food. So canned food for cats is much, 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 much better than dry food. Dry food is actually how we created the majority of bladder disease and kidney disease in cats, because we're making them stay chronically dehydrated. Aren't we smart? So the pet food manufacturers, anyway. So that's what I would do there. Just go super, super slow. Make a half a batch. Literally, maybe you're going to put a 1/4 cup in the refrigerator and freeze the rest of it in something like half a cup or 1 cup increments. And then as they start to take the food a little bit better, you can begin mixing it and gradually phase out the canned food. So that's what I would do, Jennifer. It's a painful process, but eventually they get there. All right, guys, I'm signing off for real this time. And you guys are very welcome. Thank you so much for showing up. Thanks for sending in questions, because these are things that you're dealing with on a daily basis. One other thing I wanted to mention too. I am considering, the AVMA has changed its policy to allow veterinarians to do telemedicine consults if they have a referral from the attending veterinarian, meaning if you wanted to talk with me more specifics about a particular case and get a laid out a treatment plan and and all of that sort of stuff, if your veterinarian is willing to write a referral, then would be able to consult with you and then send your veterinarian that information back, so they all everybody's on the same page, and we can all work in the best interest of your pet. There's a limited amount of that I could do, but if that's something that's of interest to you all, let me know in the comments section. It will take a little while to execute. The upside is, as I mentioned last week, I was at the Amen Clinic. My head's working a lot better, and I dig it. So love thinking through cases, and I'd love to be able to help you guys more. So let me know what you think about that in the comments section below. And if it's something you're interested in getting a little bit more information about, probably in about 1 to 2 weeks I'll have a little bit better game plan. But email us at support@theoriginalcrockpetdiet.com. Jenna will keep that those emails together, so as we get kind of closer towards being able to figure out how to work this, we'll be able to let you know what's going on, and you'll be the first to be able to have those consults. Thank you again, and remember, your pet's best health starts in the bowl. Have a great week, and we'll see you next Thursday.